On December 31st, 2019, China reported 27 cases of pneumonia from an unknown cause in the city of Wuhan in central China. The majority of people affected were workers from a local seafood and live animal market. As the virus spread and more cases were announced, talk of a deadly pandemic began circulating. Since then, flights to and from China have been restricted. The World Health Organization has declared the new coronavirus a public health emergency of international concern. And billionaire Jack Ma has pledged $14.5 million for a cure. I'm Juman Jarallah, Deputy News Editor at The National. This week on Beyond the Headlines, we are explaining what coronavirus is and asking, how concerned should we be? The coronavirus is actually the name of a family of viruses it belongs to. This particular strain doesn't have a proper name yet, but it is known as 2019 novel coronavirus. The first cases were reported in Wuhan, China, but it has now spread to countries around the world.
Most of the cases are epidemiologically linked to the seafood and animal market.
That was Dr. Amr Mahmoud Al-Naggar, an emergency specialist and head of ER at Medcare Hospital in Dubai. Since news of the coronavirus broke, the global impact has been palpable. Precautions against the virus have led to a fall in demand for oil in China, with Brent trading at its lowest in more than a year. The travel industry has been hit too. Airlines such as Qantas Airways, Air Canada, Singapore Airlines and British Airways have suspended flights to China. Emirates and Etihad continue to fly, but only to Beijing. Hong Kong has cut off many of its routes to China too. China has responded quickly by beginning construction on 2 new hospitals to deal with the outbreak. They also banned all travel in and out of Wuhan, where the virus began. The hub, home to 11 million people, has become a ghost city. One resident described the scenes.
Still, life goes on. There are some people driving despite the shortage of gas, and there are definitely delivery men still out delivering. Every now and again I see people walking with groceries or, driving to motorbikes with groceries. People are staying inside. Doesn't look like buses are running.
Tarek Yasarovich, spokesperson for the World Health Organization, explains how far the coronavirus is spreading.
We still don't know what is the source of it. We know that coronaviruses are circulating in animal world, but we don't know where exactly and how it actually jumped to human population. Well, it is very difficult to predict where this outbreak will go, but we know for sure that majority of cases are in China, in Hubei province, and that we have seen some ongoing transmission in other countries. We have to remember that this is a coronavirus, and it is being transmitted through droplets. For the time being, according to Chinese national authorities, the mortality ratio is around 2%. But obviously, as we keep testing people, we may see more milder cases, which would bring this mortality ratio down.
Currently, there are no vaccines to prevent infection. 100 scientists from Wuxi Biologics in China have been dedicated entirely on developing a vaccination for the disease. But even the most optimistic estimates suggest a mass-produced cure would take 4 to 5 months. But how does this strain differ from others, and how worried should we be? In 2003, severe acute respiratory syndrome, better known as SARS, killed 774 people globally, according to the World Health Organization. In 2012, the Middle East Respiratory Syndrome, or MERS, killed 862 people worldwide. Both diseases were caused by coronaviruses. Although these numbers may seem small on a global scale, due to the nature of international trade and travel, the threat of contagious disease has to be taken seriously. The Ebola crisis started in a village in Guinea, West Africa. The first patient is thought to have been a 1-year-old boy who subsequently died. Between 2014 and 2016, the Ebola virus spread rapidly across countries in West Africa, killing over 11,000 people. So is this outbreak a pandemic or an epidemic? First, let's explain what the two terms are. An epidemic is when a disease is actively spreading, whereas a pandemic is a geographical spread, something which affects entire countries or the whole world and not just a certain region. Is this Wuhan virus slowly turning into a pandemic? The World Health Organization does not yet classify the coronavirus as a pandemic. It has declared the outbreak as a public health emergency of international concern. Tarek explains.
We have standard procedures at the World Health Organization when we look into different events and we look at what is the risk at the national, regional, and global level. And so obviously it's a new virus. It's definitely something of a concern, and this is why WHO has declared global health emergency on this, because we have to work all together in a way that we don't isolate countries or communities, but we work together on one hand to understand the virus, and we work on treatments and vaccines, and on the other hand, helping weaker health systems around the world.
Tarek says it's crucially important to keep the public informed to prevent unnecessary panic.
Every new pathogen will create a fear, will create a concern. We need really to say to people what exactly we know, but also what we don't know. That mortality ratio is about that percentage, that majority of people who have died are people over 40 years of age with underlying health conditions. And this is something that we need to understand, but also to say to people that, yes, there is a risk. What we really want now is that countries around the world are on alert, and that we don't take unnecessary measures that would go beyond what has been recommended by WHO following the decision of the emergency committee.
A small number of cases have been identified in the UAE. Dr. Amr from Medcare Dubai explains how the hospitals are tackling the threat.
Screening of the fever is happening at the airport. And once again, we stress for the public, just if any patients coming from the endemic area, they have to report for the nearest medical facility to report if they have any symptoms. So if we are receiving a patient in the emergency department with symptoms of flu, fever, cough, throat pain, headache, shortness of breath, and pneumonia, with a history, and this is very important, that they have a history of recent travel to an endemic area like Wuhan or China within the last 0 to 14 days, or contact with a sick patient with positive coronavirus, those patients, we take them directly to the isolation room, where the doctor and the nurses are fully equipped with the personal protective equipment. It's actually something called level 4 personal protective equipment. Nasal sample is collected along with the throat sample, and we send it directly to Ratifa Hospital, and within 1 hour the results will be out. During that time, patient is being admitted to the isolation room, and we give him fluids and symptomatic treatment as far, because there is no treatment for the coronavirus until now.
Should people be worried? And what can they do to help control the outbreak? Tarek elaborates.
A person walking down the street in Abu Dhabi, basically should not be that worried at this stage. Everyone should be taking normal precautionary measures. What is really important is that people who are from affected areas like Hubei province and other places in China that has seen ongoing transmissions, that people do not travel if they have symptoms that are consistent with the respiratory diseases. So really for ordinary people, it's just follow the advice of your national health authorities and try to get the correct information, and don't really believe everything that is posted on the internet.
Dr. Amr tells us panicking is not the right way to go about it.
The regular surgical mask, which is available in the market, it doesn't make you stay away from being infected, even from the normal flu, which is now H1N1 or the other flus. So definitely it's nonsense to wear the mask in the public. It makes them more panicking. Panicking is unproductive in such situation. It's better to increase the awareness about hand hygiene and how to make the protection from getting infected. But as for now, the cases are being contained in the facilities, and there is no contamination outside China.
Thanks this week to Dr. Amr Mahmoud Al-Naggar and Tarek Yasarovich. This podcast was produced by Aisha Khan, Arthur Edison, and Erica Al-Kirshi. If you liked this episode of Beyond the Headlines, please subscribe and leave a review. Also, follow our coverage of the coronavirus on thenational.ae. I've been your host, Juman Jarallah.